Hi, I'm Shalini Arunogiri and I'm Clinical Director of the Hamilton Centre, Victoria's statewide centre for addiction and mental health. Thanks for joining me on this video today. We're doing this to kind of celebrate our 2-year anniversary. We're just coming up to our birthday. As a statewide centre for addiction and mental health, the reason we were set up is to really support people across the state. We know that 70 to 90% of people who have substance use problems also have mental health problems. Within drug and alcohol services, we know that 60% of people are actually presenting with both drug and alcohol challenges and mental health, and that's about 50% in the mental health service setting. So this is the crux of why the statewide centre was set up, really so we can change our services and systems to be able to support people to get the care that they need where they're actually accessing treatment. I think for us it's been an exciting journey, hitting the ground running, getting our services set up. We do 3 key things. The first thing is clinical support, the second being training and education, and the third being research. And just a little bit of a glimpse into the work that we do. Our clinical support across the state is delivered by our partners across networks run by 5 health services: St Vincent's Health, Western Health, Austin Health, Goulburn Valley Health and Eastern Health. Together, these 5 services support clinicians who are trying to support their clients across mental health service settings and residential drug and alcohol treatment. An example, for instance, of a client journey that we recently supported was someone with a chronic psychotic illness who was trying to access care for both his mental health challenges, but also living with chronic pain and opioid use problems. So throughout this kind of episode of care, we were able to kind of support not just the client and his team, but also a multidisciplinary team that we bring together, including addiction medicine specialists, psychiatrists, pharmacists, social workers, lived experience workers across that whole clinical team, and be able to make critical changes to his medication treatment, but also link him into support services that are able to support him beyond that journey. So that's just an example of one of the types of services that we're able to deliver. But also, across the service that we've been running, we've had 2,000 referrals. That's 2,000 individuals and families that we've been able to connect with across the state. And that clinical support that we offer is also what drives and informs our education and training offerings. And we have online support offerings, but also a range of face-to-face workshops that we've been able to deliver, including in regional settings. We've had workshops in Bairnsdale, Albury-Wodonga, and we're about to go out to Bendigo next. So that's been a real highlight for our team, to be able to connect with services locally and get to hear, I think, about some of the challenges that people are experiencing. Our education and training offerings have been accessed by hundreds of professionals across the state, and if you're a clinician or worker in a Victorian alcohol, drug or mental health service, you're able to access this at no cost through our website. And I guess in terms of our research delivery, this has really been a portfolio of different offerings that really looks at applied and translational research. So we're not interested in sort of just the theory and the evidence base, but how we actually translate and implement that in care. So a couple of the offerings that we're currently looking at in our research portfolio include services that are looking at how we can implement stigma interventions to kind of change care and attitudes on the ground, and also a range of work around trauma-informed and trauma-focused care delivery as well. The reason we kind of want to be able to kind of get out there and connect with people is really because we're looking at how we change services, how we change systems. One of the questions that keeps me up at night is kind of trying to really understand, how do we leave the system better than how we found it? How do we actually continue to drive and move sustainable change? Now, if you're a clinician or worker working across mental health or drug and alcohol services right now, the situation can be really tough. I think we're all very pragmatic and we try to find workarounds and ways to make the system work for us and for our clients. So I think what we're really invested in is being able to drive that change so we can make the system as a whole function better, the system as a whole be able to change to support clients to be able to get care where they need. At this stage in our journey, we really want to acknowledge the support we've been getting across the sector, acknowledge the passion and drive across our teams and across our networks. If you're a clinician or worker who's sent us a referral or jumped on the phone to call us, really a huge thank you to you. We have a request for you. If you can spread the word, let your friends know, let your colleagues know that we exist, that we're here to support people. And if you're a clinical leader or a service provider, we really kind of have that request to reach out to us and connect with us. We love problem solving, and we'd love to be able to work together to be able to look at what's troubling you in your service and what your clients need. We're really looking forward to working with you, and thank you for being part of our journey.